Hi, my name's Jack Billi. I'm a general internist and I've worked at the university for 38 years. One day when I was in a meeting and we were talking about hand washing, I said, what's my system to make sure that I wash my hands every time? And why is it so hard for people to remember to clean their hands going in and out of the patient room? So I decided I would make my own system up. And so I want to tell you the story of how I did that. So the first thing I did was I said, why don't I create a little reminder for myself? So I wrote on a sticky note, wash hands. And I wrote that on the note, and I would take that into the room when I went to see a patient. So it looked pretty much like this. Bring my patient chart into the room with my sticky note. This is 2008, mind you, but I was trying to make some headway on this problem. So we're going to the exam room with my patient. And then I'd close the door. And I'd put the sticky note on here. And I'd sit down and take care of the patient. But what happened? Most of the time that worked. I'd remember when I walked in, I would sanitize my hands when I put the note on there. And then when I went to leave, I would see the note and I would sanitize my hands. But sometimes I wouldn't see the note, and as a result, my head was so much in the patient's problems that I'd just walk right out the door and forget to clean my hands. So I said, well, maybe I should change where I put this note. So the second week, my experiment was to put the note on the handle. And that way, when I'd go to hit the handle, my hand would hit the note. I would always remember to wash my hands. So that worked pretty well. Come in the room, wash my hands, put the note on the handle, sit down, see the patient, get up, hit the note, and as a result, sanitize my hands. What I found was occasionally, because of the sticky note not being so sticky, the note would fall on the floor. Next thing you know, I walked right out of the room without washing my hands. So the third week, I got a piece of Scotch tape, and I put the sticky note with a piece of Scotch tape on the handle of the door, and as a result, it never fell off, and I was 100% complete and accurate walking in and out of the room when I remembered to bring the sticky note in. And that was the problem that I tried to attack in the third week. Because the first patient that I would see, sometimes I would forget the sticky note. And so I had to design a system to make sure even my first patient, I would have the sticky note with the Scotch tape, put it on my handle, and remember to do it. So I'll show you the experiment I ran in the third week. So the problem was that sometimes I would walk into the room without the sticky note. And the reason is that we keep the sticky note on this folder. So this is the folder that I use to get information to me from my medical assistant, nursing home forms to be signed or other home care orders and things like that. And I send papers back to my medical assistant with that. And so what we decided was that we'd keep the sticky note on the folder so that I would get it each week, because I would get this folder every week. But my medical assistant would bring this folder in maybe 8:15 or 8:20. If I had a 8 o'clock patient, then I'd end up going into the room and forgetting all about the sticky note. So I decided I needed a better way to remember to use the sticky note. This is my little locker here with my name on it, and every time when I would come in to start my clinic, here's the way things would be. My white coat would be in my locker. So as a result, what I said was, why don't I put this sticky note on my locker? And that way, with its little piece of Scotch tape on it, and that way, when I come in, every time I go to see the first patient, I always get my white coat. I've never gone in to see the patient without my white coat. It's got my stethoscope and my pens and things like that. So I would go to get my white coat. Aha! I would see the sticky note. I'd put that on the patient's chart, get my white coat, put my white coat on, and then go into the room with my sticky note. And that way, even for the first patient of the day, I was able to have the sticky note. Eventually, one of my medical assistants actually made me this cute little green laminated card. And so instead of the little sticky note now, I use that every week. And so that's my signal to remind me to wash my hands. And so how could I tell if this was working? Well, I started keeping track. You can see this scribbled on here. I started keeping track week after week, in the room and out of the room, 100%, 100%, 100%, 100%, 100%. And I just kept track of that for months until finally I decided that I think my system was working, and I didn't need to actually record this. And to the best of my knowledge, since May 2008, I've been 100% compliant, 100% complete and accurate, washing in and out of the room using this simple system. It took me 4 weeks to develop. Notice I didn't get it right the first time. I actually had to go back and find what were my remaining failure modes and then design a little tweak to make that better. So I'm sure there's even a better way than this, but for now, this is my system and it works for me. So you should not adopt this system to wash your hands. And my question for you is, what's your system? How have you developed a system that makes you 100% complete and accurate? And don't tell me you just remember to do it, because it's important, because vigilance is not a system. Thanks.